If you're waking up abruptly during the night or you're tired during the day, you may be wondering if you have sleep apnea. If your partner snores excessively or even stops breathing, you may be wondering if they have sleep apnea. According to the National Sleep Foundation, 18 million Americans have sleep apnea, so it's not at all uncommon, but it is underdiagnosed and undertreated. Sleep apnea has numerous short-term and long-term health consequences. It is much more than a bad night's rest or loud snoring that keeps your partner from also getting a good night's sleep. Apnea comes from Greek and means an absence of breath, and apnea is when someone stops breathing. During sleep apnea, there may be complete pauses in breathing for a few seconds or even as long as a minute. There are 3 primary types of sleep apnea. The most prevalent type is obstructive sleep apnea, which is often referred to as OSA. Obstructive sleep apnea, or OSA, occurs when the soft tissues in the airway relax and block airflow in and out of the lungs. When we sleep, smooth muscle naturally loses its tone, but for people with OSA, the muscle relaxation results in a blockage or obstruction. Snoring is the sound of obstructed airflow vibrating against floppy tissues in the airway. All snoring is not indicative of sleep apnea, but particularly loud snoring is a common symptom of obstructive sleep apnea. People who snore may have partial or complete obstructions. Even partial obstructions can be compromising to good rest and good ventilation. Central apnea is another type of sleep disorder. It is caused by a disruption in signals between the brain and the heart that causes pauses in breathing during sleep. Mixed apnea is a third type of sleep apnea. People with mixed apnea suffer from a combination of central apnea and obstructive apnea. People who have sleep disorders often complain of daytime sleepiness or wake up with headaches. Some people notice that they wake up suddenly during the night choking or gasping. Partners of people with sleep disorders may notice excessive snoring or even witness interruptions in breathing. Some people with sleep apnea report difficulties falling asleep or staying asleep. Waking up often due to nightmares can also be a symptom of a sleep disorder. Regularly waking up with a dry mouth or sore throat in the morning can also be a sign of sleep issues. Many of the risk factors for sleep apnea are also symptoms. Sleep apnea can cause high blood pressure, but high blood pressure can also contribute to sleep apnea. Heart disease, obesity, especially if the BMI is over 35, depression, diabetes, and a neck circumference greater than 16 inches are all potent risk factors. Sleep apnea can also contribute to heart disease, weight gain, depression, and insulin resistance. As with many things, the older we get, the more vulnerable we become. The risk of sleep apnea goes up considerably after the age of 50. Sleep apnea can be life-crushing. It doesn't just make you tired. It's associated with a host of nasty consequences to your health. Stroke, high blood pressure, and increased insulin resistance are all strongly linked to sleep apnea. Daytime drowsiness causes traffic accidents and on-the-job injuries. Memory loss and impaired concentration, mood disorders such as depression, anxiety, and irritability result from ineffective sleep. Sleep apnea also contributes to erectile dysfunction and cardiac disease. So listen to the signals from your body. Listen to those observations or those frustrations from your partner. If you use a Fitbit or other device that can monitor your sleep at night, look for signs of frequent sleep interruptions if you need a bit more convincing. If you have several of these symptoms or several of these risk factors, contact your physician. Sleep disorders must be diagnosed by a physician. The physician will order a sleep study. The physician may use an at-home test kit or may send you to a sleep center for overnight evaluation. Once diagnosed, a CPAP machine with a face mask is often the first prescribed intervention to treat sleep apnea. CPAP stands for continuous positive airway pressure and works by generating a flow of air that creates pressure in your upper airway. That pressure holds the airway open so that air moves freely in and out of your lungs while you sleep. Choosing the right equipment for CPAP therapy can be a little confusing or overwhelming at first, as there are a lot of different choices to make. And the best choice for you will depend on your physician's prescription and your needs. The staff at Respshop are available to help you select the best equipment for you.